Good evening. Tonight we'll explore the connection between the gut health and the brain function. Okay, so I see a lot of clients coming with brain dysfunction, whether it's insomnia or mood imbalances, depression, anxiety, and more and more data now indicating that there is a connection between how well our gut works and the impact that it has on our brain function. So we'll begin by exploring the basics of the digestive system. Okay, so we'll have a look at how the gut works, the issues that can arise within the digestive system, and understand how the gut actually impacts our health systemically. Then we'll delve into the microbiome, what it is, and we'll look at the importance of the composition and diversity of our microbiome. We'll touch on the difference between the probiotics and prebiotics, as I hear that question a lot in clinic. And then we'll look at the health benefits of the microbiome in the gut and systemically, so for our overall health. And after that, we'll explore the connection between the gut and the brain and how the health of the gut influences the health of the brain and what is the direct correlation between these two systems. We'll look at the typical symptoms of the gut-brain dysregulation and discuss some strategies around how we can improve gut and brain health and resolve symptoms. I'll encourage you guys to ask questions to make it as interactive as possible. If there's something you'd like to learn more about and I'm not talking about it, please, you can pop a question in the chat or unmute yourself. I'll be more than happy to do that or answer questions as we go along so you don't forget. So let's start out with our gut. So what is digestion? So simply put, digestion is the breaking of food into smaller particles so that the nutrients can be absorbed into the bloodstream. Okay. We're looking at the mechanical digestion and the chemical digestion. So the mechanical digestion is the chewing of your food, okay, and the chemical digestion involves obviously the release of digestive enzymes, okay, and the hydrochloric acid. So as we look at the structure or anatomical structure of our digestive system, it looks like a long tube with specialized sections beginning from the mouth and ending at the anus. The digestion begins in the brain, and that it is called the cephalic phase of gastric secretion. So when we look, smell food, meeting people, as we look at food, smell food, that process activates the release of digestive enzymes. Okay, so we put the food in the mouth, we chew it, and the release of saliva occurs. And saliva is not a neutral substance. It actually has antibacterial properties, and it contains an enzyme called amylase that breaks down carbohydrates. After that, the food moves down the esophagus, and the esophagus is lined with muscles that move in wave-like contractions. Okay, and through this process is called peristalsis, and it moves the food down into the stomach. And the stomach has a few different functions. Okay, so it releases digestive or hydrochloric acid, and which provides antibacterial properties. Okay, so this is our first line of defense, and people that take PPIs or any antacids compromise this first line of defense and increase the risk of infections and dysbiosis in the gut. It also releases some digestive enzymes called pepsin, for example, which breaks down or preliminary breaks down protein. Okay, after stomach, okay, so the food is liquefied and it moves into the small intestine. So it's
I need to concentrate now. Thank you. So what happens now? Just make sure that you're not, just making sure your camera.
Okay, good. as you can see, the small intestine is quite convoluted, and it is like that for a reason, because it's so highly folded. It actually increases the surface area to maximize absorption of nutrients. So the first part is duodenum, and this is where all the gastric contents are neutralized, because they're quite, or acidic gastric contents are neutralized by the release of bicarbonate from the pancreas. So then it travels into jejunum and ileum, where the absorption happens. So the inner lining is again highly folded, and it contains what's called villi. And these villi they're like finger-like projections that the surface area, and again maximize the absorption of nutrients. So if we were to straight out just those two parts of the intestine, it would be about 4 to 6 meters. So it's quite impressive how that much of volume can fit into such small area of our abdominal cavity. So after that, this chyme travels into a large colon, where the water is absorbed, and the remainder travels into or towards the rectum and the anus. So two things about the colon: it houses microbiome. So most of our microbiome is in the large colon, and it also contains Peyer's patches, which is an immunological organ that protects the gut from, or provides immunological protection in the gut. Okay, so most of the immunity, I guess about 70 to 80% of the immunity is actually in the gut. Okay, that's why it's so important for any immune regulation to begin with the gut, or begin treatment in the gut. So the accessory organs, we're looking at the liver here, gallbladder, and the pancreas. So the liver is a very important organ. It plays an important role in multiple functions. So it produces bile, it stores it stores vitamins and minerals as well. It regulates blood sugar. Okay, so it stores glycogen, which is a stored form of glucose. So whenever we need to regulate our blood sugar, the glycogen is converted to glucose. And importantly, it also plays a crucial role in detoxification. So the liver has 3 phases of detoxification, converting toxic material into water-soluble material that is excreted. Okay, so it filters blood every 6 minutes. It's quite impressive, and a hard-working organ that we need to look after. In the healthy individual, it would weigh about 1.5 kilos. If in the client with cystic liver or fatty liver, it can weigh up to 10 kilos. And in an individual like that, all those functions are compromised. The gallbladder, it stores bile. Okay, so bile is crucial for lipids, or emulsification of lipids, or fat digestion, and it's also a natural laxative. And the pancreas, can you put yourself on mute, please? Thank you. And the pancreas is important for the release of digestive enzymes. So when the food gets into the small intestine, it stimulates the production of digestive enzymes from the pancreas, and each macronutrient would have its own enzyme. So carbohydrates are digested by amylases, lipids by lipases, and protein by peptidases. So very often, if there is a level of indigestion in clinical practice, we do prescribe digestive enzymes, because they are important for regulation of inflammation as well. Because if the food is not digested, it starts to ferment and cause a lot of issues like bloating and flatulence, or constipation, or diarrhea. So let's just have a look at the multiple functions of the gut. So it works as a guard, sustaining and protecting our overall health. So I mentioned before that gut is our first line of defense against bacterial infection, or viral infection, or fungal infection. And if that line of defense is compromised, then the risk of infection is highly increased, okay, or malabsorption as well. So it allows us to absorb water and nutrients, converts food into the building blocks, breaking down protein into amino acids, and then rebuilding a different type of protein that the body requires. For example, it produces up to 70% of all our neurotransmitters, like dopamine, GABA, and serotonin. Serotonin is also involved in the regularity of bowel movements. So in that constipation type of picture, making sure that adequate levels of serotonin are produced is important. So as I mentioned, 70% of our immunity is found in the large colon. So it supports the immune system, communicates with the brain. It houses the enteric nervous system. Okay, so again, it constantly in communication with the microbiome and the autonomic nervous system, which is your sympathetic and parasympathetic arms of the nervous system. So the sympathetic nervous system regulates the fight or flight response, and the parasympathetic nervous system is for digestion, relaxation, and healing. So modulates stress, mood, pain, again through microbiome, as well as the vagal nerve and the enteric nervous system. And yeah, obviously it has the gut microbiome, or the diversity of gut populations that will determine our overall health.
The digestion of food takes place by passage through several organs. Digestion begins in the mouth.
So I just want to make sure, can you hear? Can you hear the video?
When the teeth grind and crush food into small particles and mix with amylase, an enzyme that breaks down starches. The esophagus delivers food to the stomach. In the stomach, food mass is mixed with hydrochloric acid, enzymes, and other gastric secretions that further digestion. The acidic environment helps reduce growth of harmful bacteria. The small intestine is the primary site for digestion of food, nutrients, and water absorption. The small intestine is divided into three parts: the duodenum, the jejunum, and the ileum. The ileum is important for vitamin B12 absorption. The biliary system includes the gallbladder, bile ducts, and some cells in the liver. The gallbladder stores and concentrates bile. It releases bile into the duodenum to help absorb and digest fats. Together with secretions from the pancreas, this helps to further digest carbohydrates, fats, and protein. The liver processes nutrients absorbed from the small intestine. Bile produced by the liver assists in fat digestion. The liver also detoxifies potentially harmful chemicals. The liver breaks down and secretes many drugs. The pancreas secretes digestive enzymes into the duodenum to help break down protein, fats, and carbohydrates. The large intestine removes water from undigested matter and forms solid waste to be excreted. The large intestine is the site of bacterial fermentation of remaining carbohydrates and protein components. The large intestine also synthesizes small amounts of vitamins, for example, vitamin B12, and stores and excretes feces. The rectum receives stool from large intestine and holds stool until it is evacuated. The anus is important for control of stool.
Okay. So we'll, if you have any questions, you can unmute yourself or put a question in the chat. We'll discuss what constitutes and what issues arise, and then we'll move on talking about microbiome. Okay. So if you don't have any questions, I'll delve into the next step. A healthy gut, it requires quite a few systems to work within that gut ecology. So we're looking at the microbiome, the enteric nervous system that I mentioned before, the quality of diet and the amount of fiber to feed the microbiome, the quality of or the integrity of the gut wall barrier, okay, and digestive enzymes. So whether we secrete enough digestive enzymes to initiate the digestion process. So if any of these aspects are compromised, the overall function or the digestive capacity would decrease. Okay, which can lead to not just inflammation in the gut, but also issues more systemically, more globally within the human body. So the intestinal permeability, when increased, will allow toxic components as a result of digestion, or if there is an infection and the pathogenic bacteria produce those toxic components, to be released into the circulation. And leaky gut is impacting your joints, your brain. It can lead to autoimmunity, blood sugar dysregulation, fatigue, skin issues like psoriasis and acne. So as you can see, the gut is the foundation of health. It's where our health really begins. And in any condition, this is where we need to turn to understand how what's happening in the gut can be impacting everything else that happens in the body. So irritable bowel syndrome, whoever asks me about IBS, you can unmute yourself and we can talk about it in more detail. Do you have any specific question in relation to IBS?
Thanks, Olga.
Yeah.
Look, just if the prebiotics are any good for the IBS, and if there's any wonder foods that that you can eat nearly every day or every second day, just a little bit of to help that. Is it the yogurt and all of those sort of?
So when it comes to IBS, so we're looking at the nervous system dysregulation and low-grade inflammation and then imbalance in the microbiome. Clients that come or that have the diagnosis, or we suspect they have the diagnosis, a lot of them have SIBO, okay, which is a small intestinal bacterial overgrowth. So very often we'll be testing those patients for this type of dysbiosis in the small intestine and putting them on what's called a low FODMAP diet. Have you heard of the low FODMAP diet?
Yes, I was seeing Alex for a little bit, and is it Celia? I think it was Celia before that. Yes, and that was wonderful, the low FODMAP.
Okay,
I'm still following it, and
okay.
it's done wonders for me.
Okay, so for those that don't know, FODMAPs are small carbohydrates that are not digested in a small intestine. And so when they get into the large colon, they tend to draw fluid and get fermented by the bacteria that are there and cause a lot of irritation in the gut. And it can lead to bloating, fluid retention, or diarrhea, constipation. So alternating between constipation and diarrhea, depending on what are the symptoms they have or the type of infection they have in the small intestine. Whether it's methane-based or hydrogen-based bacteria. And FODMAPs, they stand for fermentable oligosaccharides, which are your grains, gluten-containing grains like wheat and rye and barley, as well as onion and garlic and legumes. Disaccharides, so it's lactose found in dairy. And monosaccharides are simple sugars. So that would be a good example would be honey or apples, or just fruit, or some fruit. And polyols like sorbitol and mannitol found in artificial sweeteners and some fruit and veggies as well. So eliminating those specific foods, okay, so there is an app developed by Monash University that you can download and follow. Or a meal plan developed by a nutritionist or dietitian or naturopath, 6 weeks. And generally after 6 weeks, during that 6 weeks, we do a lot of gut repair. And after 6 weeks, we start to not only gut repair, but also elimination of any infection. And after 6 weeks, we start to reintroduce foods one by one. Okay. And generally during those 6 weeks, people find that the inflammation does come down. They lose some weight that was there due to fluid accumulation. The brain fog reduces and they just feel so much better. And essentially the patients do work out what works for them, those foods out, and then introducing them one by one makes the picture so much more clear as to what they react to and what they can or can't have moving forward. For most patients, it would be just 1 or 2 foods or food groups. So for example, if they react to gluten, they find substitution for that, and that's what fixes their issue. Yeah, they find that culprit, eliminate it, and changes everything: the way they feel, the way they eat, and the way they absorb their nutrients as well. Sorry, who was asking me about IBS?
Thanks, Olga. What you've just said is, wonderful.
If there's still a bit of dysbiosis or SIBO, even though you're on low FODMAP diet, the probiotics can disturb the microbiome, causing some side effects. So we really need to dig deeper to learn if there is a chronic infection that we need to, or dysbiosis that we need to eliminate, okay, to get that long-lasting relief.
I think I'm at that stage. If I don't stick to the low FODMAP, then I find that I get into a bit of trouble if I eat too much garlic and too much onion. I've only put tiny bits in now just for the flavouring, and that seems to make a big difference. And small amounts of the fruit and vegetables. I'm back onto most of them. But steering clear of those four main things: the gluten, the lactose, and
And sometimes it's just the depth of gut work that you do. And if you stick with it, generally we recommend like anywhere between 3 to 12 months, depending on the extent of the symptoms and how long they've been there. And I find that if you do a deep gut work, the symptoms don't come back, or they might, but it's not going to be an ongoing issue.
So is that just staying with the low FODMAP, or is there a little bit more to it? Are you able to go into that? Or?
So as I said, we have to look at other factors, do more testing to see if this is part of it, if stress is part of it, if leaky gut is part of it, find out like how long the gut repair was done for, and just do more investigation into it, if that makes sense. So you can contact me and we can discuss it on the phone if you like.
The goat's milk, is that more beneficial for those, or is that still got the lactose in it?
Doesn't have as much lactose, but a lot of people can tolerate it much better because of the structure of say casein protein that is not as inflammatory as it is in cow's products.
Thanks for that, Olga.
It's okay, my pleasure. So we're looking at IBD, or inflammatory bowel disease as well. So 70,000 Australians do live with IBD. And under the umbrella of IBD, we've got ulcerative colitis, Crohn's disease, and celiac. So ulcerative colitis generally impacts the large colon, starting in the rectum. Crohn's can impact any part of the digestive system, and mainly impacts the small intestine, where the absorption of nutrients occurs. Okay, and that's an autoimmune reaction to gluten. So that inflammatory environment impacts the integrity of the gut wall barrier, and then obviously the systemic inflammation gets quite extensive as well. So food sensitivities, we looked at FODMAPs already, dairy, lactose, it could be also cat. So a lot of people don't take that into consideration, and they just eliminate lactose products, or they have lactose-free products and still continue having symptoms because they might be reacting to casein, which is the protein part, and gluten. Gluten is quite inflammatory for a lot of individuals, whether you get symptoms or not, and especially for those individuals that do have mental health presentations, whether it's anxiety or depression or insomnia. Eliminating gluten for 30 days actually makes such a huge difference, even though they have no direct gut symptoms. Okay, so we'll have weak spots. Some people feel it in their joints, some people feel it in their brain, some people feel it in their guts. Okay, microbiome, why is it important? It's important because we're actually more of a microbial being than a human being. The gut microbiome is made up of 100 trillion microorganisms, and that's about 10 times more than we have our human cells. Okay, so we're more a microbe than a human, interestingly. When we look at the health of the microbiome, we generally look at diversity and the composition. There'll always be some pathogenic bacteria, but it's all about the balance. So 85% of good bacteria and 15% of bad bacteria. Organisms like Candida, for example, or E. coli are quite a healthy part of your gut microbiome. But when they get out of control and overgrow, that's when problems start to set in. The factors that influence the type and the variety of the microbial populations that you have, or what defines a unique bacterial fingerprint, are the following. So how you were born, okay, whether you had cesarean birth or vaginal birth, natural vaginal birth, first foods as a baby. So the microbiome, your unique microbial fingerprint, is formed within the first 3 years, more or less 3 years, so depending on the person, the environment, that stays with you for the rest of your life. Okay, it can fluctuate here and there, but that fingerprint is yours, is your unique for as long as your age and gender, where you live now. Stress level can impact the diversity and the composition of the microbiome. It's very conducive to the growth of bad bacteria. Medications like antibiotics and the pill, and the quality of your diet. So whether you have enough soluble fiber to support the production of small chain fatty acids by the good bacteria, and the small chain fatty acids are important to reduce inflammation and to maintain the health of the microbiome. So why is it important? The microbiome supports the digestion of the food that you eat and the nutrients you absorb, healthy energy production. It controls inflammation and supports immune function. So it supports the production of serotonin, GABA, and dopamine, so improving your mood, vitamin production such as folate, biotin, B12, and K2. So as a human body, we do not manufacture any vitamins, but the microbiome, if it's healthy, can. So it's important in healthy metabolism and weight maintenance. It supports bone metabolism, improves sleeps, manages pain, supports healthy reproductive function. Actually, there's a microbial population, or the group of microbes, they're called estrobolome, and they support healthy estrogen metabolism. So women that have PMS or symptoms of PMS generally will look into their gut and the liver function as well, because the microbiome is implicated in that process. Microbiome dysfunction. So what impairs the function of the microbiome? As I mentioned, they love their fiber, so poor diet is a big contributor. Food intolerances that increase inflammation, lead to leaky gut and malabsorption of nutrients. Medications, mentioned those, so antibiotics, anti-inflammatories, steroids, the acid blockers, as I mentioned before, the pill as well. Environmental toxins, heavy metals can incite inflammation, but also pesticides, that is quite common in our food, herbicides, BPAs. Okay, that's in plastic. So wherever we look, yeah, there are always environmental factors that can be influencing the health of our microbiome and the gut overall. So alcohol and smoking, excessive stress, and overgrowth of yeast and bacteria. So when that happens, it can lead to a number of conditions. Okay, because they depend on the health of the microbiome, and when the microbiome is diseased, it can not only lead to, say, Crohn's disease, but also, as I said, mental health issues, type 2 diabetes, rheumatoid arthritis, which is very gluten related, and inflammation, gut inflammation related. So any autoimmune conditions, really. All right, that's our video.
What is the microbiome? Though we don't often think about it, we're actually more non-human than human. Trillions of microscopic organisms, or microbes, call the human body home. Organisms such as bacteria, viruses, fungi, and even microscopic animals live all over our body, on our skin, and even inside us. These tiny organisms make up our microbiota, and most of them, about 95%, live in our gastrointestinal tract, more commonly known as our gut. And the combination of microbes, their genes, the environment they live in, and the stuff they produce is called the human microbiome. We've actually known for a long time that the human body is teeming with microscopic organisms. Dutch scientist Antonie van Leeuwenhoek observed bacteria scrapings from his mouth way back in 1683. But it's only relatively recently that we've begun to study the relationship between our microbiome and our health. And while the research is still in its infancy, the microbiome has been linked to everything from obesity, asthma, and allergies to autoimmune disorders such as rheumatoid arthritis and diabetes. The microbiome also influences how our brain functions and is linked to conditions such as depression, anxiety, and stress. These links explain why there is now an emphasis on creating or maintaining a healthy gut. And a healthy human gut consists of several thousand types of bacteria, as well as other microbes, though some types would be more common than others. The exact composition of a person's microbiota is unique, and it's constantly changing. It depends on what you eat, where you live, who you live with, what you touch, and even how you were born. Before we are born, we have very little, if any, microbes inside us. Microbes really start to colonize our bodies the moment we are born. The way we are born, either naturally or by cesarean, influences the type of microbes we first contact, and hence the type of microbes that will first colonize our bodies. Babies born naturally come into contact with microbes found in the mother's intestinal and vaginal fluids, whereas in a cesarean birth, babies tend to be colonized by microbes typically found on the skin and in hospitals. Similarly, breastfed babies will have a different microbiota profile than formula-fed babies. From the day we are born, our microbiome evolves quickly and reaches maturity during the first 2 to 5 years. After that, it stabilizes, resembling that of an adult. As adults, changes to our microbiota are likely to be small, but major shifts in composition can occur when we radically change our diet or take antibiotics, which kill bacteria. Significant life stages such as puberty, pregnancy, and menopause also cause large changes to our microbiome. And as we get older, our microbiome ages too, and the number of microbe species decreases. Since most microbes are in our colon, or large intestine, what we eat feeds our microbiota. And what a healthy microbiota needs are fiber-rich, complex carbohydrates. Simple sugars found in refined carbohydrates tend to be absorbed quickly and don't reach the colon for the microorganisms to feast on. But complex carbohydrates can't be digested in the small intestine and make their way into the colon, where bacteria breaks them down through fermentation, enabling us to use nutrients we couldn't otherwise. And the microbiota provides essential vitamins that we can't make ourselves, such as B vitamins. Perhaps most important of all, the microbiota helps our immune system develop, effectively training it to distinguish between good microbes and bad pathogens that cause disease. This symbiotic relationship between humans and the trillions of microscopic organisms that live on and within us has evolved over thousands of years, and we couldn't survive without the many specialized functions they provide.
Pretty mind-blowing, isn't it? So just a little slide to make a distinction between probiotics and prebiotics. Probably most of you already know that probiotics are the microbial populations which have so many extensive benefits that we've just talked about, and prebiotics are their specific herb or plant-based soluble fibers that feed the beneficial bacteria, making sure that they produce the very valuable short-chain fatty acids, which reduce inflammation and support the health of the microbiome and the intestinal lining of the gut. All right, so we come into our last section of the presentation, talking about the gut-brain connection or link. So the gut and brain, they're linked. Okay, they're linked through, and the microbiome is like an intermediary that enables that communication to happen between the gut and the brain. Okay, as you can see from the slide here, from the picture here, So what happens between the brain and the microbiome in that direction. So the release of neurotransmitters like serotonin and dopamine, neuromuscular control of peristalsis or bowel movements, the activation of the autonomic nervous system, okay, by communication through the enteric nervous system, and the secretion of mucus. Okay, so, and then from the gut to the brain, we've got the vagal nerve activation, which is the parasympathetic nerve within the autonomic nervous system, and it controls the relaxation response. Okay, so the immune signaling. Okay, so microbiota to brain. So whatever happens in the gut on the level of immunity will be reflected in the brain. So if the gut is inflamed and it leads to leaky gut, the brain will be leaky as well. Okay, so the blood-brain barrier will be compromised, and all those toxins will get into the brain, activating the immune response within the brain. But yeah, therefore, brain integrity is, or barrier integrity of the gut is correlated with the barrier integrity of the brain. So this interaction between the gut and the brain plays a significant role in both gastrointestinal and mental health. So when that connection is in balance, both the gut and the brain work well. Okay, when anything changes within that dynamic, then we start to see, so that can be contributed by stress or poor microbial function. We start to see changes in how the gut functions and how the brain functions, so leading to a number of symptoms. So before we talk about the symptoms, I just wanted to mention what neuroinflammation is. Okay, so as I said before, the dysbiosis in the gut, or any factor that leads to inflammation in the gut and the leaky gut, or when the integrity of the gut wall barrier is compromised, would lead to the leaky barrier within the brain. Okay, and that leads to activation of microglia in the brain as a result of disruption of the blood-brain barrier. Okay, so that inflammation is neuroinflammation. So symptoms like brain fog, anxiety, depression, they are actually a symptom of neuroinflammation that most likely began in the gut. So this is quite a complex picture, but it doesn't have to be. All it's showing is what I've just actually said. Gut microbiota balance. If you have more pathogenic bacteria growing, that leads to integrity impairment of the intestinal wall barrier, and that results in chronic inflammation. And that inflammation disrupts how the blood-brain barrier works and activates the microglia and results in neuroinflammation and degeneration of, or impacts how the neurons communicate with each other. It impacts how neurotransmitters are released. So looking at serotonin, dopamine, GABA. So serotonin and GABA are relaxing neurotransmitters, and dopamine is a reward neurotransmitter. So it actually compromises how your brain functions overall. So chronic stress can also lead to changes within the brain. So chronic high cortisol levels can actually change the size of hippocampus, for example, where learning happens, where memory happens, and that inflammatory response is only aggravated by cortisol. So these are the symptoms of gut-brain imbalance: bloating, heartburn, diarrhea, constipation, abdominal pain, IBS, sugar cravings, chronic fatigue, brain fog, memory loss, insomnia, fibromyalgia, psoriasis, anxiety, depression, and behavioral disorders, including ADHD and autism. So quite an extensive list covering so many different areas of the human body, really. So there's some tests available for gut dysfunction. Okay, so you can look at or assess if there is a level of infection, whether it's H. pylori or any other worms or parasites, pathogenic bacteria that live in the gut and the immune system can't resolve them. We can analyze the stool for the functional markers of the gut, whether there's candida, overgrowth, and how we absorb nutrients. Yeah, so microbiome mapping. Yeah, we check for infections and dysbiosis. Food sensitivity testing or food intolerance testing is really helpful when people struggle with ongoing constipation or diarrhea and certain elimination diets do not work. So SIBO testing, so we test for glucose or relation between lactulose and glucose, and then we can also test a lactose for lactose and fructose intolerance, which is a breath test. So for IBS, the SIBO breath test can be very valuable because if SIBO is present or small bacterial overgrowth, we can implement a SIBO specific diet, which is quite similar to FODMAPs, but more strict in some ways. And some clients find it really helpful. So what can we do to improve the gut-brain function? Okay, so we start with the gut, seal and heal the gut, identify if there is a degree of infection, eliminate the infection, repair the gut wall barrier, making sure that the immunity of the gut is improved and we reduce the inflammation. Okay, so as we seal the gut, we can support the brain. If there is a level of adrenal fatigue, definitely looking at the stress levels and how we can manage chronic stress and repair or rebuild the resilience of the HPA axis or hypothalamus pituitary adrenal axis, again to reduce inflammation and to support how the enteric nervous system works, support the production and release of neurotransmitters. Okay, so we talked about GABA and serotonin in the context of anxiety, which is really important to support an elimination if necessary. Managing stress, again, it feeds into adrenal health and HPA axis health, and into consideration the impact that stress has on the health of the microbiome and how we absorb nutrients and how we eliminate. There's a little slide to show what stress does within the gut. So it impacts gut microbiota, slows down mucosal blood flow, or sensitizes the enteric nervous system. Okay, so it makes it so you feel pain more acutely, reduces secretion of digestive enzyme, dysregulates gut motility. So therefore, it can help that alteration between constipation and diarrhea and increase paracellular permeability or intestinal permeability. So what can we do to take care of our gut in terms of foods that we eat? Again, working out what is causing the issue here, what is causing the inflammation. So what might be healthy for someone might not be healthy for someone else due to food sensitivities or dysbiosis that they currently experience. But essentially opting for a diet that is rich in soluble fiber. And again, it has to be done very carefully because sometimes eating too much fiber can actually cause a side effect. Okay, it can cause more bloating because if there is a level of dysbiosis and the fermentation happens in the wrong place, it can cause side effects that are not, I guess, what we look for when we treat a patient. So starting very slowly, understanding what the targeted or what we're treating. So that's why I always prioritize testing, not always, but in most cases I do, to understand what we're targeting and what we're treating. So these are just general guidelines, but might not be suitable for everybody. So if somebody presents with anxiety, for example, or depression, definitely working on the nervous system or brain fog, for example, work on the gut and then stimulating blood flow into the brain. So using herbs like rosemary or ginkgo. You can use bacopa as well. Turmeric is fantastic for healing the gut and reducing inflammation in the gut and systemically. So you can use rosemary as well as a herb or turmeric in your cooking. So they're kind of easy or accessible ways to improve gut and brain function. And detoxing, like not just from junk food, but also from digital junk food, I suppose. So really managing stress in a very holistic way, whatever works for you, whether it's walking 15 minutes a day, watching movies, not being in front of the screen every day, just giving your brain a bit of space to detox and relax and rewire the nervous system, reset the nervous system. Yeah, you're ready to get started. If you have any, so we're done. This is all I wanted to cover with you today. I really encourage you to ask as many questions because it's a really deep and extensive topic. And there's just so much research that's coming out around gut-brain connection and how important it is for our overall health. So if you've got any specific questions that are pertinent to your situation, somebody that you know, yeah.
I could probably do all of those, to be honest.
Yeah.
I like the last point there about the weekend, about the digital detox.
Yeah.
Important.
So relevant in this day and age. We're all addicted to a certain degree to something. Yeah. Just so much overload, sensory overload for our nervous systems.
Yeah. Definitely.
Thanks, Christy.
Hi, I was just wondering, so how would you know the condition of your gut? Is it based on whether you have those symptoms that you've mentioned, or?
Generally, yeah, you look at the symptoms because a client comes in feeling something, right? So we take a thorough case history and then I'll just try to understand what those symptoms mean. And if they've been happening for a long time, then I would suggest testing. Yeah.
Oh, okay.
So based on symptoms, and then we can do additional tests. You can definitely start with gut repair and work on the diet. And then depending on what the symptoms tell us as we move forward in our treatment, then we can evaluate even further and understand the picture more fully. Yeah. So it does take time. Yeah.
And so what is the best way to start improving your whole system within itself? Is it just simply changing your diet? Is that the best way?
I think it's a really powerful way.